Thank you, Mr. Speaker. Central Alberta Region Healthcare is no longer a priority on the Alberta Health Services Top 20 list. The people of Central Alberta are starting to wonder if they are less valuable than other Albertans. I understand this is a 20-year problem, but the current government took Red Deer Central Region Hospital off the priority list. This hospital has not had a new bed in 17 years, despite a population growth of 50% or better. Can and will the Minister of Health provide a reason why this hospital was taken off the priority list, leaving 450,000 Central Albertans with substandard health care?
Thank you, Honourable Member. The Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the question about ensuring that everyone, no matter where you live in this province, gets the right care at the right place by the right provider. And for decades, we saw that there were drastic cuts in a number of areas throughout the province. And I'm not one to say that things are perfect in Alberta, far from it, and that's one of the reasons why we're campaigning on making life better for Alberta families, by making sure that we're investing in providing stable health care services and working with frontline providers. Mr. Speaker, it's important to us to ensure that every part of this province gets quality health care.
For supplemental.
Thank you, Mr. Speaker. Given that the government has created 15 different planning documents in the last 10 years, which included Central Alberta every time except this last one, and given that metro areas have received 8,300% more funding than Central Alberta residents, the people of Central Alberta are wondering why they are not equally valued. We are beyond planning. How does the minister suggest we move past 10 more years of planning and on to real, actual new beds and essential programs that other hospitals have had for years already?
Good question.
Thank you very much, Mr. Speaker, and for the important question. We are working to make sure that every part of this province gets the right care, and that means that they have the right investment in terms of deferred maintenance. We have significant deferred maintenance in this province because of drastic, irrational cuts that happened by Conservative governments. And instead, we're moving forward by increasing the infrastructure maintenance plan, by making sure we invest in that Red Deer Hospital. We've done things to increase opportunities for obstetrics and for operations, and there is a great corridor now between Calgary and Edmonton with a central hub in Central Alberta and Red Deer for cancer treatments as well, Mr. Speaker. The members opposite want to cut. We want to make sure that we're protecting important health care services for all Albertans.
Second supplemental.
Thank you, Mr. Speaker. Given that this government does not have a real good track record on plans, Albertans are not trusting that the requirement for yet another plan, or any plan to help the people of Central Alberta, will ever come to fruition. It appears Alberta Health Services would rather provide plans than essential medical services. Can the minister be upfront and tell Central Albertans if plans are a deliberate but deceptive denial of resources instead of providing fair and essential medical services to Central Albertans?
Honourable Minister.
Thank you for the question, Mr. Speaker. And we are making important investments in making sure that folks in Central Alberta, just like people living in Sylvan Lake, have increased access to essential after-hours care, Mr. Speaker. And I'm so proud of the fact that we've been able to work with community, not treat community like an obstacle, Mr. Speaker, like happened so many times in the past where political games were played, with communities that deserve to have better access to health care. The members opposite want to cut. We want to make sure we're working in partnership to invest in where it's needed to make sure that everyone has access to the very best care. You can't cut $2 billion and increase access at the same time, Mr. Speaker. The members opposite know that.